All right, everybody, we're going to get started. I apologize for the delay. Today's a good topic because we're going to look at chronic pain. And chronic pain, essentially chronic pain is very misunderstood. It's one of those things that everybody's pointing to where the pain is, and most of the time it has nothing to do with where the pain is. So maybe 15 years ago or 14 years ago, I had suffered through some chronic pain myself, so I know a lot about it because I had to suffer through it personally. So I take care of a lot of people who have chronic pain, a lot. And the big deal is that there are other causes to chronic pain other than what the doctor's talking about. The doctor talks about arthritis, or the doctor will talk about inflammation or pain. What we look at is that the causes a lot of times are not related to the diagnosis. The diagnosis a lot of times is the effect, it's not the cause. So what we're going to talk about are the hidden causes of chronic pain, and we're going to show you some natural ways to resolve these to where you can improve your quality of life. All right, so there we go. We had some technical difficulties. Statistically, over 26 million people suffer from back pain. 76 million people suffer from chronic pain. And when we look at healthcare costs, we're looking at $635 billion annually for healthcare and productivity loss. When we look at the over-the-counter drug use, 280 million in sales, and then addiction, the 11 billion for addictive substances, and that's, you guys have heard about a lot of this stuff lately on the news. These are narcotics that are prescribed, and people end up becoming completely addicted, and they're going to have to go to rehab clinics to get out of this type of cycle, because over the counter, there's one thing, prescription narcotics are right up there, highly addictive. And in fact, we're now consulting with the addiction center, First Step Addictions. Some of you have seen their grand opening was on Monday. And one of the things that we talked about was how these people, they have addiction problems, but how the problem is much bigger than the addiction. This problem is what we call brain reward deficiency syndrome. And what that means is their brain chemistry is not at a place to where they feel good naturally. So they have to go outside of themselves in order to feel good. So if you had good brain chemistry, you would feel pretty good, and you wouldn't have to do synthetic means to feel good, because your own brain would make antidepressants. It would do it automatically. And what we find is that even in the last 2 months, we've had 19 heroin-related deaths in this little town. 19. And we're in a town of 19,000. We had 19 people dead. And it all boils down to having to go outside of themselves to feel good. So this is something that's really interesting, because one of the things we spoke about to this addiction clinic was how to change the brain chemistry without using synthetic substances. So the brain chemistry can be altered through a few different things. The number one thing that we do in our profession is we take stress off of the nervous system. When you take stress off of the nervous system, it stimulates areas, blood flow and chemistry up in the brain. So if I take stress off of the spine and nervous system, it actually has a stimulatory effect to all the antidepressant substances in your body. So your body can make antidepressants, and you end up feeling really good. Some of you have gotten off the table and said that I had slipped you guys something. And it's a different kind of feeling, and the reality is it's your own brain making those feel-good chemicals. And one of the things that they studied with this, they had heroin addicts get adjusted 5 times a week for 4 weeks. And the success rate for them completing their 30 days was 100%. Now the national average is around 60%. 40% check themselves out to go shoot up around the corner. So 100% of these people getting regular adjustments completed their detox program. So it's really impressive when I show them how it affected their anxiety and their depression and their calls to the nursing station. It's really wild. They had less than 9% of the people checked into that clinic who were getting regular adjustments, less than 9% of them had to use the nurse. Now the national average, they had a group in there that was getting fake adjustments. The national average was 59%, which means they were calling the nurse's station all the time to get a fix. You know, the nurses will deliver a little small dose to take the edge off of their withdrawals, and they didn't have to use them. They were getting adjusted. They were making their own good, feel-good chemicals. So we talked about the standard treatment. Standard treatment, basically most people will treat themselves. They'll go get over-the-counter drugs. If those don't work, they end up going to the opioids. These are the ones that are definitely more addictive. If that doesn't work, it's a flow chart of events. They'll get corticosteroid injections. The issue with that is that that ages the joint about 10 years per injection. The steroids will demineralize the bone tissue and make the ligaments become like taffy. Instead of being stable, it makes them loose. It does give some temporary pain relief when you get steroid injections, but the bad side is that it ages the joint very fast. If those don't work, epidurals, nerve blocks, and if that doesn't work, they do surgeries. The surgeries happen so frequently that the insurance company has a code, and we see these all the time, failed back surgery syndrome. It's because we've had people get the surgery and not address the cause. So what happens is, within a 5-year window they did these studies, they have a high reoccurrence. They end up having the same issue because the causes were never fixed, especially if the cause was emotional. By the way, most pain syndromes have a huge emotional component. If you don't fix the underlying emotional stress that is being stored in the body, you're going to have side effects. I mean, you're going to have failure of surgeries because surgery can't cut out the stored emotional stress. It can cut out the inflamed tissue, but it can't cut out the stored emotions. Stored emotions live in your brain and in your body. So we have techniques in our clinic, some of you have experienced them, where we will release stored emotional trauma. We call it tissue-locked emotion. We'll release the emotions from the body, and the body then can heal itself better. Next. So the real causes are poor movement patterns. Other than emotional issues and inflammation, we see that people are using their bodies not in an efficient way. They're bending over, using these little spinal joints like this. They're not using the big ball and socket joints that are designed to hinge and move. They're using these little spinal joints. They're tiny little joints, and they're bending like this at their spine, and they're ended up injuring themselves. They're doing it repetitively without even thinking about it. You watch someone pick up their keys, you watch someone, bend over or vacuum, and I have my patients simulate these movements in the office, and it's horrible what they're doing. They don't know how to use the joints properly. They just have developed poor movement patterns. The other big thing is the GI tract imbalances. We talked about this to a few patients earlier today. The number one cause for the low back, for the disc issues in the low back, these are people who become pretty much incapacitated when that disc tears open and pushes on that soft nerve. Most of those are coming from a valve where the small intestines and the large intestines come together. It's called the ileocecal valve. And when that happens, it will cause half of the muscles that stabilize your spine to shut off, and it will create a wedge where all your weight will pinch on the disc until it ends up tearing and herniating. And you could go in there and take out the herniated disc. Many of the people, that's what they do. But when they stand up after they get out of their anesthesia, if that valve doesn't get fixed, that imbalance is right back. They'll end up blowing out the disc above and blowing out the disc below. We just had a guy who's 37. He had his first failed back surgery in 2002. And his second failed back surgery 2011. And the third one they want to fuse his entire low back from L1 to his pelvis. They're like, well, these two failed, and it's called a micro discectomy. They took big chunks of the disc out, they fused it at that level, they put cadaver bone in there, and first thing I checked when he laid down, ileocecal valve. Weak as could be. It's a big guy, a big strong guy. I pushed on his leg, and that leg just collapsed in. I mean, I used 2 fingers, collapsed his leg, and I said, until you get this fixed, we're going to have more failed surgeries. Now, he's only been under care about 2 weeks, and the pain has already reduced by 80%. And that was one of the first things that I did. I found a doctor who did that technique when I injured my back, and the first thing he did was poke on this valve and said, well, you have a ileocecal valve dysfunction. I said, I didn't know what you're talking about. It's my back. No, it's not your back. It's this valve right here. And when he had me hold pressure on this valve, all the strength in my leg returned. When I took my hand off, my leg went weak. And he said, we have to fix this valve dysfunction in order for your disc to heal. And that was a very big lesson for me, because now I have helped countless people by fixing this little valve. Countless people with disc injuries, we've been able to help. The other thing that we see is that the gallbladder, if you don't have the gallbladder, some of you have had your gallbladder taken out, it's still going to be the same pattern there. Gallbladder is a little sac that hangs off of your liver, upper right, under the rib cage right here. If you don't have a gallbladder, you still have over 2,000 miles of what we call biliary tree. Biliary tree is all the little ductwork that leads in and drains into the gallbladder. Everybody still has that, even though the little sac is gone. Most problems with the gallbladder will end up causing upper back. Like the ileocecal does the lower back, the upper back is caused from the gallbladder. That's pain and burning between your shoulders. A lot of people feel it after they eat food. They feel pressure in here. It also goes up into the neck. It restricts the neck. And if it's really bad, it will cause headaches. These are the types of headaches that end up happening right at the base of the skull. Those are all gallbladder-related headaches. So if you have a gallbladder issue, a lot of that discomfort is going to be on the right side, the right shoulder, between the shoulder blades, and the base of the skull. Again, fixing the gallbladder also will fix almost every case that I've had with constipation. Almost all of them will get better fixing the gallbladder. Almost all of them will get better. Everybody's like, well, no, you need laxatives, or you need to eat more fiber. No, you need to fix the gallbladder. Fix the gallbladder, all this pain goes away, headaches go away, neck tension goes away. They start going to the bathroom normally again. If it's on the left side, we see that that is related to the spleen and pancreas. Sometimes the stomach, but the spleen and pancreas will cause the same issues on the left side. So a lot of people are coming in with, well, it's always on the same side. It's right behind my shoulder blade. It goes right here in my neck. It's always the same thing. And we check their spleen or their pancreas, and there'll be a lot of inflammation in those organs. In fact, you can lay someone on their back and poke on this organ, and you can get them to jump off the table if it's really inflamed. So we'll flip people over. We'll poke around on their stomach or on their spleen, on the head of their pancreas, and they'll jump off the table. We support the pancreas. We take the inflammation off. You could poke at that organ all day and not have people jump off the table. So a lot of the neck and shoulder issues are from the upper GI. A lot of the low back issues are from the lower GI. Neuromusculoskeletal imbalances. We see people all the time because they've moved wrong for so long, or they've had accidents or injuries. They develop scar tissue. They develop poor patterns in their brain. Part of the brain that controls the posture is right back here. 9 times out of 10 when we work on somebody, I did this for almost 2 years, where I would measure their height before and measure their height afterwards. 90% of them would have a 6 millimeter increase in height after one visit. And it wasn't because we put them on a rack and stretched them out. It was because we reset this area back here called the cerebellum. When you reset the cerebellum, naturally you'll stand taller. You don't have to try. I love these parents. You ever see these parents elbow their kid in the chest? Sit up straight. And these kids, they sit up straight. As soon as they forget about that, they go right back to this. Boom, sit up straight. You can punch him all day long. He's not going to sit up straight until you update his cerebellum. We update the cerebellum with specific adjustments. Toxicity could cause a lot of pain, inflammation, and then the biggest one, probably 80% of all pain, is emotional. And everybody's like, no, I picked up my keys. That's what they tell me, you know. It was because I picked up my keys. That's why I'm in such pain. And then I asked them, well, how many times have you picked up your keys before? And they're like, well, I've picked up my keys for the last 20 years. Well, why did your back blow out today? Well, it was how I bent over to brush my teeth a certain way, and I couldn't stand back up. How many times you brush your teeth? You know, it's not about brushing your teeth. It's not about bending over. It's all about the straw that broke the camel's back. So when that stress, when that emotional stress gets to a point, it'll get to a point to where even a sneeze will incapacitate you. You know what I mean? It's not about whatever that action is. Okay, it's always an accumulation. So one of the first things that we do is we actually show people the normal curvatures in the spine, and we explain to them how we need to move. We need to be hinging from this big ball and socket joint, not from these little joints in the spine. So one of the things that we'll show people is developed by a chiropractor. His name is Eric Goodman, and Dr. Goodman had a severe debilitated degenerative disc disease where when he was in school, he was pretty much incapacitated. He was in constant pain, very similar to what happened with my spine, and he developed these to basically help rehabilitate himself. So what we do is we show people how to do these particular movements. And the first movement, essentially all it does is it shows you how to use the big hip joint to bend from. You bend from your hips instead of your lower back. And he has a 4-minute video on YouTube. It's called Better Posture in 4 Minutes. And that's the video that I have. How many patients?
I can't even count how many we've
I do it. My pain went away immediately, like I told you. Yeah, with everything I've learned in physical therapy, I told you I watched it at the library, went home the next day, went to brush my teeth, and I was like, oh, that hurt. Now what did I watch on that video? And I did it just off of my memory recall, and instantly the back pain went away instantly.
You got the book.
I got the book and read the entire book of all the different exercises, but the main one that stays with me is that alone.
Yeah.
Just going down and being able to squat like a child playing on the beach.
Yep. Yep. It's amazing stuff. Foundation Training is what it's called. He wrote a really good book. In our fitness center, we actually have the DVD. So if you want him to literally walk you through like a personal trainer, he'll take you through every intricacy of every movement. I actually, when I first started doing this a few years ago, I actually started in his book. I did exactly what he said. I did 2 weeks of the basic exercises, and I didn't think it was a big deal until I started doing them, and I started sweating. I'm like, I'm not doing anything. How is there sweat dripping off of me? I'm not doing anything. And then the second week, you add everything you learned in the basic. You do the intermediate, which is probably 3 or 4 more exercises. And then the last 2 weeks, so it ends up being a 6-week program. The last 2 weeks, you do all the things you learned in the basic, all the things in the intermediate, and then you add the advanced movements in. And man, that is a workout. You lost 50 pounds.
And I've lost 50 pounds.
Wow.
Very good, very good.
You said you have that in the garage.
We do.
Still work out with that in the garage.
We do.
I'll see you tomorrow.
Yeah, it's good stuff. It's good stuff. So essentially, we want to show people the basics of changing your movement patterns, which is getting adjusted. We talked about updating the cerebellum. We talked about just walking, and that's what you were doing. You started walking.
Yeah.
Foundation training, starting to learn how to move and bend. All the repetitive movement people do day to day will change. It'll reprogram the movement patterns. And then a balanced strength exercise. So what we show people, once people get stronger, we want to show them resistance training that's balanced. Most people are not doing a balanced routine, certainly not customized for what they have going on. Most people are doing all pushes and no pulls, so they end up overdeveloping certain muscle groups, and they end up hurting themselves. So this is something that is a very easy first step, and just this alone, a lot of times, resolves people's issues. So the gut imbalances, first thing that we talked about, I had a patient of mine come in, and he was having all sorts, and he was a big guy, had all sorts of issues with his gut. And I asked him, you know, what are you doing? What are you eating? And he was combining fruit with protein. Okay, so he was eating eggs and all this protein, and then he would put a handful of fruit into the blender and make like some kind of fruit smoothie drink. And within 20 minutes, he was having heartburn every time. And I said, well, the digestive enzymes in your gut will digest protein with vegetables. It won't digest fruit with protein. Things will actually turn rancid in your gut. So what we explain to people is if you're going to have fruit, have it by itself as a snack with nothing else. And if you're going to have protein, have it with vegetables, because vegetables are rich in enzymes. Okay? So the enzymes that are included in vegetables actually are synergistic in protein digestion. So protein and vegetables. And how much blood sugar came down with you with eating protein and vegetables instead of all the starches?
A lot.
So from 400 to 93. Okay, she was in the hospital with blood sugar of 400. And what did they have you eat? What did the diabetes specialist have you eat when you came out? What was it? Cereal and bananas and orange juice?
Yeah, right.
And what did I say to you?
Don't eat that.
I said eat it if you want to become insulin dependent. If you want to shoot yourself up with insulin, keep
Right.
eating that way.
Right.
She didn't want to do that, so
Well, I didn't know.
So we sent her basically exactly what I just said, which was vegetables. You take the grains out. Everybody tells you grains are the healthiest thing. You know, oatmeal is the healthiest thing. Now, you take the grains out, you put vegetables and protein, and you lost almost as much as her, 52 pounds the first 8 months or something like that.
Yeah.
Because he doesn't cook, he lost 32 pounds just by being around you. Okay? So these
Oh, we
are
did it together.
right. These are the things that you're not gonna learn about. You know, they're not gonna tell you. You got a diabetes specialist, a nutritionist, telling her to eat grains when her blood sugar was 400, and even with drugs it was 200, 160, until she started changing her food. And then once you start combining the food, you're gonna have less bloating, you're gonna have less inflammation, you're gonna feel better. All the upper back and headache in between the shoulder, we talked about the gallbladder, the stomach, the pancreas, and then the low back, like I said, is always related to ileocecal valve. So people say, well, so what about this ileocecal valve? What's the big deal? There's no big deal about it. The way it gets screwed up is when you get gut infections. Now I can almost guarantee about 90% of the people here will have some sort of gut infection. And they're like, no, I don't have any fever. That's what I said. When I first had this injury, I went to a guy who was in practice, for 52 years he was in practice, and he poked at my stomach. And I said, it's back here. He goes, no. He poked at my stomach. He goes, you have an infection in your gut. And I said, I don't think so. I don't think I have any infection in my gut. He's like, you have an infection right here, and he told me that if you get rid of this infection, your low back will get better. You know, he said your low back's going to get better if you clear out this gut infection. So, sure enough, I didn't care. I said, I'll listen to whatever you say, because right now I can't walk. I couldn't walk at that time. Really, I was on ice pretty much the whole time. My wife didn't let me take a lot of the drugs that I wanted. I wanted surgery and drugs, she didn't let me take it. The neurosurgeon at the Cleveland Clinic said you need surgery right now for this issue. It's not going to go away. And Christina said, no, you got to come back and do some of this stuff. And I said, I can't walk. I just want to get the surgery, get it done with. My brother had the same surgery, same surgeon, same injury, and he's had recurring issues now since he's had the surgery, five or six times. He was over 2 weeks ago, he couldn't even feel his leg, his left leg. I said, and that's the side he had the surgery on. Well, how long you haven't been able to feel your leg? Well, ever since whatever. Like, it's been a chronic issue. And thank goodness I listened to Christina, because she said, if you're not walking in 6 weeks, go get the surgery. And within 3 weeks I was walking. But I went to another guy, another old doctor. He poked on my gut. He was in practice about 40 years. And he says, you have infection in your gut. And I said, what? Well, whatever. He said, do whatever you got to do. Went to a third doctor. He poked on my gut and said, he didn't say anything about infection. He said, it's all emotional. It's related to this valve here. And he cleared the emotional stress. And I went home and I ended up passing about 1.5 inches of pus in my urine after he cleared the emotions of my kidney. And I didn't know what that was about. All I knew was after I passed all this pus that my back felt better. Went back and we did the same thing. Remember, you packed me up in the blazer and packed me on ice, and we went to all these different doctors, and ended up doing the same thing.
Which doctor was it? The old man, that old?
He was one of them, and then the other one was Dr. Lawton, who comes in our office now. Some of you see him.
Yeah.
Up
Yes.
in Cranberry,
Yes.
right?
And he was in
That's
Cranberry,
right.
so we made our rounds all around
yeah.
Pittsburgh, Pennsylvania, and
Oh, yeah.
anyway, he did it again, and I ended up peeing about, instead of 1.5 inches, it was about 1 inch of pus coming out after it settled. And I couldn't walk, so I was peeing in a jar. It settled about like that.
Oh.
And then following week, same thing. Peed again, a little less. Anyway, by the third week, I only peed out about 1/4 inch of this pus from my kidneys or wherever this infection was. You know, they just said it was somewhere in here. That's when I was able to walk, as I had less of an infectious burden in my gut. Somehow that valve restored its function, the emotions that were stored released, and I was able to get full return of function. Yes?
Was he just poking on you and that was it, or were you taking an infectious burden supplement?
At that time, I was taking a lot of different stuff. My sister-in-law was working on me too. She's a nutritionist, what do you call it, natural hygienist, acupuncturist, and she said, you need to take this. And she told me I had a gut infection too. She said it was yeast and candida. And the old guy who was in practice 52 years, he told me it was a gut infection, a yeast overgrowth in my gut. And I just took whatever anybody gave me, anything I can do to get better. She had me hooked up to these, some of you know about this, but Ulda Clark, you hold on to these things and then you basically zap yourself. It clears off eggs, parasite eggs, and kills off infection. So I'll go through 60-minute cycles of basically shocking myself. And I didn't care. I just continued to do whatever I needed to do. And I got better and better. So within 6 weeks, I was seeing patients again. And within 7 months, I got a second MRI, and the disc had healed over 70%, resorbed all the shredded disc, had literally resorbed and healed 70% in 7 months. And they weren't, that's not supposed to happen. Yes?
So was the infection caused by your injury, or you had it before the injury?
All of them said it was a long-standing infection that weakened those structures. My experience is that with that ileocecal valve, when it closes or it gets, irritated, it shuts all the muscles off on one half of your body. So if I had pain going down my left leg, the muscle that he tested was my right half that was weak, and the ileocecal valve's over here on the right. So when I stood up, because I didn't have any strength, it would cause a wedge on the left, and that's where the disc tore open, and that's where all the jelly donut squirted out onto the nerve. It was about 17 millimeters of disc tissue pushing out on the nerve, and that's why I wasn't able to move or walk. I mean, I couldn't do anything. But it was the infection and the emotional stress that blew that valve structure out. And as we took the infection out, I remember that guy, he was in practice 52 years, he put me on Thymex. Thymex is an immune supplement. And he put me on Zymex. Zymex is a gut flora that feeds, it's a fertilizer for your intestines. He put me on Zymex and Thymex, and that was my first exposure, real exposure to standard process. And I just did whatever he said. My sister-in-law put me on probiotics. You know, I just took those straight. I was just anything and anything. Everything and anything, and then within a certain amount of time, it just got better and better. Within 15 months, I was actually able to start training again. I've been in martial arts for a lot of my life, so I couldn't do anything. I was afraid to train. I was afraid to do anything. But I was able to start training. I was able to start. That's when I started kettlebell. I started learning about kettlebell, which is another form of exercise we do. Anyway, I never thought I would be able to do any of that where I was not even a year earlier. But yeah, it's been an amazing journey, and of course, we're lucky because we're able to help a lot of people with this. Yes?
I just want to share with the group, I want to thank Dr. Camelli for helping me, and just when he's talking about how he was and how he's doing good, just thank you for sharing. But just the chiropractic adjustments really do help. Years ago I had cancer and I fractured L4, L5, and then I've been seeing Dr. Camelli, it seems like all of my life, because I'm a martial artist as well. But then a few years ago I was in a car accident, and then I started having back pain once I was able to get a car again, and I paid for my own MRI, and I had bulging discs, but the fracture did not even show up. So the adjustments, like if you feed your body and take care of everything and get the chiropractic adjustments, like the bones healed to where the fracture didn't even show up as arthritis on the x-ray. So just the chiropractic adjustments do help. And it's like sometimes you can explain it and sometimes you can't. I was so happy that I was sitting with a doctor where I live. There was a retired doctor and then just somebody from the high school. And the doctor was going back and forth, and I'm literally with the MRI report that just showed the bulging disc, and I'm thankful I'm good. And I'm going, I'm not lying, there was a fracture there. It was chiropractic adjustments.
And yeah, and if you told anyone, any medical doctor,
yeah, they won't believe you.
Or you told any chiropractor, in fact, that you would adjust a fracture, they would look at you like,
yeah,
you are absolutely.
You did a lot of iliocecal valve stuff,
right.
And even now I
right.
do that on my own with what's going on with the back. Yeah.
It's amazing. It's actually amazing. The body can heal itself. We've actually had people post surgery where their entire neck was fused, and I've had people come in as patients post surgery. That's my first visit with them, and we will actually adjust them through their collar. They have little breathing holes. We have instruments that will sneak in there, and we will adjust. We'll adjust them through that, and when they get their collar off, this is what their neck is supposed to look like when you get your collar off. Here's about the motion. That's about it. When you get the right kind of care, the woman I'm talking about took her collar off and had complete range of motion. She almost made her therapist fall off the chair. She said, well, what is going on? How are you able to move your neck? But nobody factors in these things. You know, healing the bone, healing the fracture, healing the scar tissue. Nobody factors these things in. The next thing that we're looking at is inflammation and toxicity. One of the things that we see a lot of are people who are getting into foods that are causing inflammation. Now, we showed in our office, we have a video that was showing how certain food allergens like dairy, cow dairy, when you go over 20% of cow dairy casein, which is a milk protein, you actually turn cancer cells on. And when you go under 20%, you can actually shut cancer off. So you can turn cancer on and off with your foods. You can also turn inflammation on and off with your foods. And if you haven't had your food allergens tested, it's very easy to do. Just mention it to me or one of the doctors in the office, and we can check you to see what your primary core food allergens are. Now, if you're brave like Jobette up here, you'll eliminate all these, and all of a sudden you'll feel amazing, and then you can play the experiment, which is reintroducing the food allergen. And what happened when you reintroduce your food allergen?
Immediately within 3 hours was sick.
Sick in 3 hours. So you can have an immediate response. You will never, ever think about those foods the same. When you eliminate them out of your diet, you reintroduce, and it causes you to be sick immediately. And I have a lot of people do that because people don't believe me. You know, I'll tell them, try doing this, try doing that. until they do a 2-week elimination of their food allergen and then they reintroduce it, you'll see immediately they'll get sick. Usually 18,
I went like 4 months.
yeah. Yeah, so you did the extreme version of
Complete
it.
cleanse of it.
Yeah, cleared all your food allergens out, and she was smart. She reintroduced one at a time. So she did wheat the first week, she did corn the week after that, got sick, chocolate the week after that.
Yeah.
Anyway, you'll know right away what your core food allergens are when you get sick like that.
Congratulations, by the way, you look great. Because I remember seeing her at the office a couple months ago, and her and
Yeah.
I were talking about the food thing.
Yeah.
Congratulations, because I
Thank
remember
you.
you saying, I don't know if I can do it. And I remember going, you can do it, you can do it. Congratulations.
She's doing
Yeah.
wonderful, wonderful.
Yeah.
I could go around and brag on almost a lot of people in this room, but I'm not. We'll get through. We got to go through this. I don't want to put anyone on the spot. The other thing we do is detoxification. We do a 21-day detoxification. Some people, that's way too much, 21 days. We will do a 10-day detoxification. And then for people like my dad who are really wimpy, we'll do a 7-day detoxification. And that's what I did the 7-day too. And then he did the 7-day. But there's lots of different ways to detoxify. Eliminating sugars. Sugars are highly inflammatory. Adding anti-inflammatory nutrients in like omega-3s. We use cod liver oil, we use tuna omega oil, we use calamari oil. All of those are highly anti-inflammatory. Boswellia, turmeric, that's in something called Boswellia complex.
What is Boswellia again?
It's like frankincense, you heard from the Bible, frankincense and myrrh. Frankincense is a same category of Boswellia. It's an Ayurvedic herb for inflammation. We use that. The complex has turmeric, celery seed, and ginger in addition to that. We talked about that the other day. Beets, Brussels sprouts, and kale are the key ingredients to almost all of our detoxification and inflammation programs. All right. So the mind-body connection. We learned a technique called neuro-emotional technique, or NET. And NET is the one where we learn how to turn this valve dysfunction and fix the ileocecal valve. And there's 3 categories in the emotional realm when it comes to this pain. If you have an issue where that valve shut off, it will be linked to your emotions of your bladder, the emotions of your kidney, and the emotions of your gallbladder. 3 emotional patterns will make anyone experience a ton of pain. The first one in the bladder is feeling stuck, feeling like you're paralyzed, like you can't move forward. That's the emotion of the bladder. The kidneys are the emotions of fear, being scared, fear, dread, impending doom, like fear that something really bad is creeping up on you. It's just a phone call away. You understand what I mean? You're sitting there apprehensive, just waiting for the stress to happen. And then the gallbladder is an interesting one. That is repressed emotions. Holding your feelings back is the gallbladder. And resentment, being upset, angry, and resentful. That you just do not let it go. It's all right. It's no problem. The computer will reboot. So the other thing that we look at with the gallbladder is these patterns between the gallbladder, the kidney, and the bladder. When you resolve all of them, you will actually get a durable correction. You'll actually get sustained relief, and you'll actually get sustained healing. And a lot of people who have never experienced NET, when they first get it done, and you start talking about emotions on when they first started in your body, you're able to determine where the first issue was. And for me, I went in there it had to be in my 20s. I went in there in my 20s, and they said it was it's when you were 8 years old. And I just couldn't believe that it had anything to do with my back. And then when he said 8 years old, school, this 8 years old, I said, wait a second, I remember something when I was that age. They wanted to not only hold me back in 2nd grade, they didn't want me to move forward, but they wanted to demote me to 1st grade. And I said, I remember that like it was yesterday, how traumatic that was. They had both of them there, and second grade teacher was like, hey, this kid, he doesn't belong here. And for, an 8-year-old, that was a big deal. It was a really big deal. So anyway, the point being is that I did not equate emotional stress, childhood emotional stress related to my disc injury. I thought there was no connection. And then as time went on, we saw that the connection, as that got resolved, the back got better and better and better. And as this computer reloads, you'll see there's a Dr. Sarno, and he is out of New York. He's written several books. And Dr. Sarno did something very, very interesting. He would do this, this class, kind of like how we are right here. And he would take people through an emotional release in a classroom setting. And these are the people that nothing was able to help. No surgeries, no drugs. They were in chronic pain. He would take them through an emotional release all the emotions within it was less than an hour, this class. Release all the emotions, and everybody, the attendees, would get up pain-free. And it was durable pain relief. And he called it the mind-body connection, Dr. Sarno. If you haven't read any of his books, Dr. Sarno it's an amazing resource. Again, talking about how the emotions will cause these issues. And he had it, his whole career, that's all he did was work on stored emotional stress. So when we look at that, in conclusion, we look at the different types of emotions being a core issue. We look at these poor movement patterns, and we look at gut-related issues causing pain. When you put these things together, what will happen is that you will eventually find, it's like a padlock that has a combination. You'll find the right combination for your body. The right combination, what we've seen over the course of working with people, 15 years now, we've seen that everybody's a little different. Some people may be 50% emotional and 50% nutritional. Other people might be all emotional. I've taken people, it was just emotions. There was nothing else going on. And just release the emotions, allow their body to heal from these emotions, and allow their body to heal itself. But not everybody will put together a physical strategy like foundation training, like getting adjusted, an emotional strategy like NET, and the technique we teach a lot of doctors, it's called quantum integration. It does address physical, chemical, and emotional stress. So a lot of the doctors that come and learn this technique, all they know how to do is align the bones. That's all they've been exposed to. Bones are out of place, we'll realign the bones, and that's that. Nobody wants to ask why the bones were misaligned to begin with. Why did the body blow out to begin with? The nervous system is like an electrical system of your house. If you plug in too much, you blow the system out. And we need to look at what is blowing your circuits out. Is it physical? Is it chemical? Or is it emotional? And then based off of that, you're able to help people. Because now you know what their specific blueprint is for healing. So it's really neat stuff. If you guys are not, if you have not had an evaluation, you'll talk to Don, and he'll get you an evaluation. We have discounts available.
Yes, we do.
So Don has discounts. We'll get you off a good significant chunk off of your
Yes, we
initial
will.
exam, right?
Yes, we
All right.
will.
All right. So Don will help you guys out. For those of you who have not been evaluated, see Don. For those of you who have been in this system, please share your story with other people who are not patients. I know you do. Daily. You should get the award for the biggest change in the shortest amount of time. I did your re-eval today. All that chronic stuff in 3.5 weeks is, what, 50, 60, 70% better? I mean, amazing stuff. So anyway, that's the stuff that inspires us to keep doing what we're doing, and we love seeing your quality of life return like that. I will stick around for questions.